Following the novel coronavirus disease COVID-19 outbreak in December 2019, Nigeria recorded its first case in Lagos on the 28th of February 2020. In a matter of weeks, the virus had spread to Ibadan, the Oyo State capital. On the 29th of March, the Provost College of Medicine, University of Ibadan, Professor Emiola Oluwabunmi Olakpade Olaokpa, announced that himself and the Deputy Provost had tested positive to the coronavirus and was on a 2-week self-quarantine.
There was initial fear, which didn't last more than 5 minutes. And how I knew there was fear was because I was asking, we were on the phone together, the Provost and I was asking him so many questions. And that shows a lot of concern. And he said, "Are you afraid?" And later I accepted it, and I was able to go through the isolation for 2 weeks.
Meanwhile, the number of new cases in the country had nearly quadrupled, yet there were only 6 centers in the entire country to cater for about 200 million people. There was thus an urgent need of more test centers. In response to these challenges, on the 2nd of April 2020, the Provost of the College of Medicine constituted a team of lecturers, scientists, and clinicians to ensure the rapid mobilization of existing capacity and human resources within the college. Thus, the vision for a clinical virology laboratory at the College of Medicine was born.
Our repository and clinical virology laboratory is a very, very important addition to the research capacity of the College of Medicine, University of Ibadan. As you know, this year, 2020, is a year of many celebrations for the college. It is the year that we ranked highest in the medical schools in sub-Saharan Africa, and it is also our 40th year of being a College of Medicine. It's therefore for us a very important event to be commissioning a laboratory such as this that would aid multidisciplinary studies. It is a molecular pathology laboratory, but we are aware that it is going to serve all angles and all specialties of medicine.
Through the support and financial donations from the Ibadan College of Medicine Alumni Association, ICOMA, and the Friends of the College, a molecular and clinical virology laboratory was set up at the Biorepository and Clinical Laboratory building of the College of Medicine, University of Ibadan.
This laboratory is very important to the College of Medicine and to the University College Hospital. So when the idea of raising funds for the college came over to ICOMA, it was strongly embraced because we believe that we need to support to get facilities for the laboratory. There can never be any meaningful activity without facilities.
The 20 million naira project, headed by Dr. Akiorumui, was timely executed in 10 days for the purpose of COVID-19 testing and was commissioned on the 17th of April 2020.
Commission laboratory for the use of all researchers in the College of Medicine, University of Ibadan, and of course its sister institution, the University College Hospital, and we thank all our donors.
I would say that this is a value addition to our services in 3 major areas. One, it will help us in our clinical services in testing our clients for COVID-19, which has been a major problem. Our samples in time past have been sent to Osun State, to Lagos State. This will relieve us of all the stress and the delays that we get in sending our patient samples, and also for our members of staff in the course of contact tracing.
We are happy that this biorepository would bring together a multidisciplinary team of researchers.
It will enable us to make accurate diagnoses in a very timely manner.
Now we have a lab where there can be collaboration between our researchers from various disciplines, and this is what we had always desired as a college and of course as a university, that there can be collaboration between our various researchers Now with the central lab and biorepository in place, various researchers from different disciplines can come together and work together to be able to find solution to COVID-19 that is currently on.
On the 21st of April, a courtesy visit was made to the laboratory by the Director General of NCDC, Dr. Chikwe Ihekweazu, and a country representative of the World Health Organization, Dr. Fiona Braka. The laboratory is equipped with a real-time quantitative PCR machine for detecting the virus, a biosafety cabinet, refrigerated centrifuges, -80-degree freezers, thermal cyclers, a flow cytometer, and many more equipment needed in a standard virology laboratory. The laboratory is also in close collaboration with the African Center of Excellence for Genomic and Infectious Diseases, ACEGID, at the Redeemers University, Ede, and the Nigerian Institute for Medical Research, NIMR. Currently, the laboratory has a capacity to run about 60 samples per day, with ongoing plans for expansion. We expect that the laboratory will evolve to provide multidisciplinary research support for several departments, units, and institutes within and outside the College of Medicine.
We need to start working on samples that we have, working on diseases, and we're not going to do this in just silos. We're working together with different people, so it's a collaborative effort. Many of the equipment we've seen today are actually donation from different parts of the college. So people are coming together to work together, both basic scientists and the clinical scientists. I, for example, am a basic scientist, so I'm working with the clinical people, and we're working together to make sure things work out for our nation.
So we thank all our donors and look forward to more support from all of them. Thank you very much. God bless.
There has been lots of news and fake news about multiple COVID-19 therapies. What should be our disposition?
There are all sorts of reports on the internet, and I'm yet to see one that has followed the standard operating procedures. Because of this frightening, the worrying, the anxiety that surrounds COVID-19, I can liken the public reaction to that of a drowning man holding on to any reed within sight, and that could be dangerous. It is important that chloroquine, hydroxychloroquine should be properly evaluated in the management of COVID-19, and that means a clinical trial. One is in the pipeline, and we are going to be able to say something concrete very soon.
What really brings down viruses is a good immune system. If your immune system is good, that is why even this COVID-19 we are talking about, a lot of people have been infected. They themselves didn't even know as such, because they have what? Good and strong immune system.
And I also want to emphasize the role of nutrition. Honestly, this is something that we all overlook most times, and we feel maybe not so important. But honestly, for us to be fine, we need to put ourselves in a situation where we see our food as our drugs, rather than when we are boxed into a corner and then we now have to take drugs as food. This is something we should never allow to happen to us. And this is why, for even our patients that took a very long time to clear, one of the factors that I could say contributed significantly to his getting so well was the fact that we were able to look at his nutrition, look at his diet, look at the components of his diet. What are those things that he needs to take that will help him to boost his immune system? And so we worked on this, and this also helped significantly to be able to help us to be able to clear his virus. And so nutrition is one very, very important aspect that we need to take very seriously.
As we look forward to the eradication of the COVID-19 pandemic, let us all put in the means to prevent its further transmission. I am Ibukun Afalami, reporting from the College of Medicine, University of Ibadan.